Is this depression or is this grief? Y'all, this is a huge, right now it's kind of a hot button topic because the new version of our Bible, of our recipe book of diagnoses called the Diagnostic and Statistical Manual, is coming out sometime soon. I don't next week. I don't know, sometime in the next month or two, and they are really honing in and trying to do a a more exhaustive job of what prolonged grief is and complicated grief, and it can be very touch and go. So the traditional definition of grief and the traditional definition of depression. So the traditional definition and construct of depression is pretty well fleshed out. You have a period of sadness. You have insomnia and guilt and difficulty concentrating, sometimes bad thoughts, so on and so forth. Like it's very formulaic. When it comes to grief, that can be very contextual. It's all in context. Because there are some folks who lose someone very close to them and they don't really respond hardly at all. Some folks lose people who are, multiple steps away and they take it very, very personally and they have a difficult time with it. And it can be anywhere in between those two extremes. And so, and then the time limit. So, in the traditional definition of grief, and I'd have to go and look, but I think it's like 6 months. And then anything after 6 months or anything after a year, it becomes not grief anymore. It's, complicated bereavement and all these other kind of ideas that to me seem very complicated and overly cumbersome. I like to try to simplify things. And so for me, when I'm teaching about grief and the way that I understand grief, it can be kind of lifelong. Now, the goal is that the grief over time lessens, but that can be over however long it needs to be. Again, my opinion. Again, take this with a grain of salt because we have the established book that gives its timeline. I don't know. Maybe I'm a rebel. I'm super mavericky, pew, pew, right? So I use my own version and I use it in context of the person who's in front of me. And so the question is it depression or is it grief? So sometimes you can actually have those things overlap. So let's say, for instance, if you lost someone really close, but that was 2, 3, 4 years ago, and you every time you think of it, you're still tearful and you're still having stomach aches and it keeps you from being able to go places and you lose your interest in the sports that you're doing and you can't concentrate in school or work. That to me meets the definition of depression, but to me it's also in the context of grief. And so I would actually keep a little bit of both. Why is all of this so important? Well, having a name for something helps us define how we treat it. And so if we want to treat depression, most times you can do a combination of therapy and medications. Whereas if you're treating grief, most times you don't necessarily have to use a medicine. It's support and structure and consistency. But you can see how those things actually overlap because you can do medicines and therapy with support and structure and consistency. And so you're treating two things at one time. But it would not be helpful to the person if they had depression and you were only treating their depression with kind of structure and support. That doesn't cover all the areas that they need. And so that's why we use these labels. And again, some people are like, no, don't label normal stuff. And I'm like, I get you. I hear you. I try not to label people either, but I also don't want people to suffer. All right. As a physician, our calling is to first do no harm, right? We don't want people to be worse after seeing us. And so we want to make sure we're doing our absolute best to do our best guess to make sure that we're in the right ballpark with the right diagnosis so that we can put the right treatment plan with the right diagnosis. And so, yeah, so teasing apart depression versus grief is very nuanced. Some people say, you know what, I'm not going to worry about those. I'm just going to kind of treat both. It just depends on the situation and the person and the resources and that sort of thing. The key from the person's perspective. So if you're a patient and you're like, oh my gosh, am I still grieving the loss of something? Am I grieving the loss of my relationship? Am I grieving the loss of my job? Am I grieving the loss of my loved one? Or is this, actual depression? One of the pointers I will give you is in those instances, like talking to your support group, like other people around you, can be really, really helpful because they know you really well. And I'm sure at some point they've seen you sad. And if they feel that it's different, like, huh, that you seem different. I mean, you're sad, but this is a different sad. That would be an indication to maybe go and talk to somebody because it may be that that is different than the grief or different than the depression that you had before. And keeping in mind that, like I said, all these things intertwine. Talking to someone who's trained to do all this stuff, like we're trained for thousands of hours of how to talk and to tease apart what they call peel back the layers, to peel back different aspects of your life and the things that you've been through and the ways that you've responded. We're trained in all that. And so, generally, a therapist, psychologist, psychiatrist, counselor can hone in on what's going on faster than you can just from reading the internets or talking to your friends. The friends are a nice litmus test to kind of point you in one way or another, but then actually talking to a licensed expert, I think, is very, very helpful. And so, yeah, so is it grief or depression? It all depends on the context. When in doubt, go talk to someone and they can help you maneuver that particular situation.